All right, so it's the May 19th meeting of the Broadband Task Force, and we got an agenda here. John Holman is joining us from USDA-Rural Utility Service. He's the field representative for Michigan. I think he's relatively new here to the USDA office, so he's gonna be our first item on the agenda right after we get through introductions here. So we got a small enough crowd that we can kind of all introduce ourselves to John. But I just wanted to point out that we got a new member. Jonathan Lane is the new IT director at Bay College. And so he's likely going to be joining us for these meetings in the future here. And John, if you're ready, I can stop my share and let you share your screen. I think you mentioned you might have a presentation.
Yeah, thank you very much, Ryan. Can I do a quick mic check? Can you hear me okay?
Yes, I can.
Great. Let me see if I can get this up and running on the share. And let me know when you can see that.
Yes, I can. And sorry, I just mentioned that we were all going to introduce ourselves to you and I skipped over it.
Well, that's okay. I think that will happen soon as we're out there in the communities. But if you want to do that, that's fine.
We'll let you go first and then we'll kind of introduce ourselves afterwards, if that's all right with you.
Sure. Yeah, thank you very much, Ryan, and CUPP, Central UP Broadband Task Force, for inviting us here. I wanted to really, Ryan asked me to give a quick overview and presentations of our programs as offered by RUS telecommunication programs, just to kind of give everybody an idea of what programs are available, funding opportunities when they come around. It's always important to get into discussions early before the funding opportunity comes, because there's a lot of work to be done to craft a proposal and get a project in for funding. And before I do that, I would like to just let you know a little bit. RUS really kind of works under the canvas of USDA. USDA, most of you might be familiar with rural development. We have housing programs, business programs, water, electric, and then telecommunications, which has a number of suite of programs. It's the only federal agency that can build a city from the ground up. So whatever discussion you're in, whatever project you have, we'd like to hear from you to see what program might benefit. Under the telecommunication programs of RUS, we really have 4 core programs. We also have one that's just recently come out with a funding opportunity, and I'll talk a little bit about that. But the first one we have is the Infrastructure Loan Program. This program's been around since the 1930s during the Roosevelt administration, Rural Electrification Act, when we first started bringing telephone to our rural communities. The program, Infrastructure Loan, still exists today. We make it fit for broadband. That's a real opportunity. I'll talk a little bit about that. We have a Community Connect grant, which is a true grant program up to $5 million per project, build out broadband to rural areas. We have a Reconnect program. Most of you probably heard of that. It's kind of taken center stage as it's just been codified in federal regulation to offer loans and or grants to providers or a broad scope of applicants to build out broadband. I'll talk some on that. I do know that there are libraries, universities in these meetings. We have a distance learning and telemedicine grant, a real opportunity for a grant up to $1 million to cover the cost of equipment for those purposes, distance learning and or telemedicine. And then broadband technical assistance has just come about as a funding opportunity, and I'll work through that with you as you're trying to engage communities. But back to the infrastructure loan, we have about $690 million available per fiscal year. We don't come close to spending those dollars. However, it is a real opportunity since with the infrastructure loan, there's really no true deadlines. Funding is available for those eligible applicants who are normally incumbent local exchange carriers or telephone companies. We can work with those folks, and that also includes tribal entities for a loan. The loan is at the cost of money, an incredibly low interest rate of 2%. You'll not find that in the private sector. Some of the benefits here are 2-year principal deferral to allow that company to build out broadband to generate revenues before meeting expenses to help with debt service coverage. The maturity or amortization term, if you will, typically comes out to 20-25 years. We can work with the applicant to add some additional amortization to make those ratios meet our requirements. And that's really based upon depreciation of the assets being used for build out of the broadband. Our Community Connect grant, as I mentioned, $5 million or less grant to build out broadband. We get about 33 to 35 million every fiscal year. This fiscal year, we're currently in a funding opportunity with a deadline of June 20th. We have about 64 million this fiscal year, a real good opportunity. Now, one of the true eligibility tests of this broadband program is one of sufficient access. The build out of broadband or the proposed funded area for those grant dollars can only be in areas that have no greater than 25 megabits per second upload, 3 down. And that's really kind of the applicant who knows those areas to whether or not that level of service currently exists. We do have a broadband grant speed for build out of 100 by 20, which really drives in a lot of fiber type projects. But we do really only look at terrestrial based broadband, anything publicly available. If you're looking at an area, feel free to reach out to me and we'll walk through that and take a look at the maps. The Reconnect program, as I mentioned, it was a pilot program out of the Consolidation Appropriations Act 2018. We now have regulation on the program. We are currently in what we call round 4, consideration for funding. We can anticipate another round with this program probably later the calendar year, round 5. But as I mentioned, let's talk about this program with your project so that we're ready to go when that funding opportunity comes about. As I mentioned with Community Connect, sufficient access is 25.3. With Reconnect, the level of service in those areas can be no greater than 100 by 20. So that really opens it up to a lot more area. You can come in through this program up to 50 million per project. That is if it's a combination loan and grant. If it's a grant, only 25 million. We kind of see a lot of applicants coming in for about 10, 15 million per project. Doesn't mean that we can't see smaller project amounts in here. So we do get that on occasion. We have different funding categories, if you will. The last funding round through Reconnect allowed us to provide grants with 0 match requirement. As you know, all federal programs usually have match, but that's a big one. That's 100% grant for the entirety of the project to build out broadband. The build out requirement is 100 symmetrical service to every premise within a proposed funded area. And on the loan side here for Reconnect, it's on a first come, first serve. We get the loans done. A lot of applicants are starting to see that as more favorable to apply for a loan through this program. We get about 550 million through the initial phases. About 2.3 billion is what we currently have for these funding rounds. So we're seeing a significant increase in funding that's available. One of the requirements there, as I mentioned, is the broadband speeds no greater than 100 by 20. There is a Federal Register notice and the regulation section there. I think Ryan will provide this PowerPoint to the group that you can use that for a quick reference. As everyone has their own mapping tool, Rural Utilities does have a mapping tool. That's the URL link right there on this web page. You can go there and you can see proposed applications, funded applications. You can also layer over other areas for different scoring criteria for persistent poverty, tribal lands, and a number of different layers. So feel free to jump on that map to see your potential area. One of the issues that we often run into with federal programs is one of stacking, where we don't allow multiple federal programs to fund any particular project in the same area. That is usually the case with FCC, Federal Communications Commission, through their Rural Digital Opportunity Fund. We do want to have that discussion if you see some overlap areas with those RDOF funding areas, because we need to understand what those dollars through FCC are for, whether they're ready to authorize. It's also going to be the case with NTIA and for their BEAD funding. Most of you probably heard that there's a significant amount of funding going through the state of Michigan broadband office, and we need to coordinate those efforts. Who can apply for these programs for build out of broadband? Just about pretty broad in scope, just about anyone who looks to own, operate, and maintain the broadband network. That does not mean that we do not allow partnerships, public-private partnerships for that matter. We just need a complete solution to the project. Individuals, legal partnerships formed with individuals and co-applicants are not eligible. Here's a snapshot of who we're getting applications funded from. A lot of for-profit corporations, as you can probably imagine. We are starting to see states and local governments taking on the role of broadband. So we're starting to see counties even coming in to own broadband and get funding for it. Tribal communities, and there are some priority points for cooperatives or local governments, if you will. The utilities are a big one. So if you're working with a utility, that might be an option. Eligible projects go through quite an extensive review in terms of technical and financial feasibility. I'll forego all the details here on some of what we're looking for, but one thing to note is that we would require unqualified comparative audited financial statements from that entity, and that has to be an unqualified opinion. Distance learning telemedicine for those schools, universities, healthcare providers, that not that it has to be that, but that's typically what we see interest in this program from. About 64 million available every fiscal year. We have a significant increase in funding for this program and interest. If you are thinking in terms or hearing anything regarding distance learning or telemedicine, feel free to contact us to see if we can get a grant up to $1 million for the project. What do we mean by distance learning telemedicine? It's the real-time interactive delivery of curriculum or telehealth. Really, it is a telecommunication program that equipment allows those connections between user sites and what we call hub sites. But it gets pretty detailed as regards to eligibility. So we can walk through a potential project with you. The program that Ryan asked me to speak on is kind of a new program. It's a broadband technical assistance funding. This is kind of unique to our programs in that it is a cooperative agreement with an eligible applicant up to $1 million per project. And anyone who is looking to understand the needs of the community in terms of broadband can come in for funding. The program, as I mentioned, is really funded through a cooperative agreement. And there are some details around that we'll have to explore before putting in the effort to apply. The eligibility requirements is really around the applicant's ability to work with community members, partners, and stakeholders. It also allows that eligible applicant to work with our staff on activities around identifying where there needs to be substantial involvement in terms of community efforts for broadband deployment. So basically, the funds up to $1 million can be used basically for a feasibility study, perhaps maybe some financial forecasts, which is really the big heavy lift in applying for federal programs, market surveys. There's quite to do with a lot of environmental work, especially when applying for federal programs, and technical design information. So those are just kind of some of the things that could be incorporated in the grant. Indirect costs are not allowable with this program, but we'll have to walk through what funding is needed for your potential project to make sure that we're crafting a good proposal. Basically, we have kind of 3 different funding categories. Up to $7.5 million is available in each, and then $5 million for supporting cooperatives. So that's about $20 million on a national level. If we're asking for $1 million per project, that's really not a significant level of funding, but this is a new program, so we look forward to seeing future funding opportunity announcements, and based upon that interest, perhaps maybe an increase in funding through this program. Wanted to give you a quick snapshot of where Michigan stands in all of these programs. $243 million. We've done some infrastructure loans for $12 million. Reconnect program, $136 million. Look for that to significantly increase as we go through this current round of funding. We haven't seen any Community Connect grants funded in the state of Michigan, which is real surprising. We see that in other states, but that's a real opportunity. I kind of call those grants smalls, but sometimes those small projects have a significant impact to areas that are significantly underserved. And then we had a broadband initiatives program. For those of you who've been around for a long time, you may have remembered that. We've had some funding for the state of Michigan there. All state investments, $8.3 billion. That's across the country. So Michigan stands pretty well to secure funding through these programs that are competitive on a national level. It's always worth mentioning that we make a special efforts to work with our tribal communities. And we do have some significant investments in tribal. There is a lot of priority point selection for tribal entities. If you are a non-tribal entity that are looking to build out broadband in reservation area, we would need resolution of consent. And that's real important that we're working with our tribal communities. Here is my contact information. Feel free to reach out, set up a meeting. I always enjoy discussing potential projects to find the program that fits. And I'm really excited about being part of the Upper Peninsula. I haven't been up there in many, many years, but I think I'll be taking a lot of trips up there. We have a lot of funded projects if you look at our map. And I would also look forward to meeting with you in person and having a cup of coffee. Thank you very much. With that, Ryan, should we open it up to questions?
Yeah, I think so. Thank you very much, John. That was really great information. So I think I'd like to share that Connected Nation actually was just notified by the Michigan Health Endowment Fund that our telehealth study for the Central UP has been approved. So we're going to see that going forward here over the summer. And I think with the results of that, that's going to provide us with some good information about the opportunities and needs in our region regarding telehealth. So I think that kind of dovetails well with this the telehealth grant, that opportunity that you have. So I just wanted to share that and allow anybody else to speak up if they have any questions for John.
This is Tom Stephenson here with Connected Nation. And John, when we're talking about the telemedicine studies for funding, what do you see being funded currently? What kind of devices, training, software?
Yeah, usually what we see is a lot of video audio type of equipment. Some of
Mhm.
those projects can get a little unique, especially in areas of telehealth, telecarts, and really specialized type of medical equipment. I don't know if anybody's on the meeting has ever used telehealth on their phone to connect with their doctors. Oh, you have,
Yes.
Tom?
Yes. I've
How
done
did
that.
that work for you?
It's not bad. I prefer, I work with Munson and Spectrum down here, and I prefer of course, I don't have it in my home. It's a monitor where they're doing eyes on the patient. My mom had that with the monitor, but they didn't down in Flint. And one morning she woke up, her blood, she had to check in every morning. She had AFib. She woke up, she had blood pressure was 280 over 160. She walked over to the monitor and they checked her out. Immediately she got a phone call, said, Mrs. Stephenson, go unlock the door, get yourself, make yourself presentable because the ambulance will be there in 5 minutes to pick you up.
Wow.
And then they notified my mom, then they notified my sister. So yeah, it's that's why I was asking what you're looking at, because we're going to be working with Ryan and they're going to come up and do a survey, but they're also going to be talking to the local healthcare providers. And so gathering that kind of information during that study would help. And that's what the whole idea behind this, when I talked to Ryan, is to make everything presentable to that something that would help go after funding like this, to gather the right kind of data to help with the grant application.
Yeah, I don't want to go too far to make any generalizations, but over the pandemic period, what we've had in the state of Oregon and even in Washington State is a lot of students, kids that didn't have the ability to have connectivity to learn. And how are they going to do that without actually going physically into classroom? Perhaps maybe funding through this program can kind of help with that. But it really is kind of the ability for the teachers to communicate between different sites. And in terms of critical healthcare facilities, if someone has a critical healthcare need, instead of traveling great distances to, I don't know, what's the major town, Marquette, Grand Rapids, Detroit, are there critical care facilities, especially in the UP, that's very, very rural areas? Maybe that, a project could help with that in terms of funding for equipment. So it can be pretty broad in scope to what it is. And that's why it's real important for us to have that conversation and kind of craft it to get some funding for it.
Yeah, maybe I'll have you and our researcher call. We'll set a meeting up and discuss this a little bit further detail. And because we've been playing in this, well, I shouldn't say playing, we've been working in this field for a lot of years now. And this is probably the fourth or fifth telehealth study. So,
Okay.
Yeah, it's, we did one I think one of them was in Dickinson. That was the first one. And to see what the issues were and then how to work around the recommendations. First thing we looked at, a lot of people don't want to use it because they're worried about their privacy. That was the biggest holdup, was the privacy, which was kind of we knew it was there in the top 3 or 4. We didn't know it'd be the number one issue. So
yeah.
But we've even had where we've had our local library here. We did experiment with Munson where we allow hotspots that are dedicated to the monitors and people, and they've used them a couple times. So there's a lot of ways of getting around this until we get the fiber built out. So Bruce and those guys get the fiber built to everybody. So because they like to see, the hospitals like to see 30 to 35 megs upload speeds. And so
when I think in terms of hotspots, I think of 2 things. 1, the cost of the equipment, and 2, the cost for service.
Yes.
So the equipment side would be eligible. But then on the service, like you mentioned, we'd be working with the providers on that.
Yes. Thank you.
Thanks, Tom.
We'll be in touch.
Yes, sir.
Does anybody else have any other questions for John? If not, I'm gonna pass it over to Tom Stephenson for an update on the My Connected Future.
So yesterday, I just got home late last night. So yesterday we finished our 31st listening tour. We finished up at Bay Mills College, and the team is heading home. And so the state of Michigan is doing 41, which is the most in the nation as far as listening tours. It was really active. I think the slowest or the least amount of crowd was there in Marquette this time. Bay Mills was packed, and so was Watersmeet up in the UP. So the state team got a lot of good information from everybody, and they should be coming back about mid-June, we're thinking. And the first place they're going to do is come to the UP. So I'll be working with Ryan about getting a location. I think they're going to try to split things up. Initially, they were talking the Escanaba area when they come back in the UP. So that's what they listed on their website, and they're kind of talking about. It's not set in stone yet, but that's kind of what they were thinking about. So that they'll come back with the draft, and then they'll be able to submit the plan. Right now, it's estimated under the BEAD that the state of Michigan initially was going to qualify for $1.6 billion in infrastructure money. And with the to back up, the state of Michigan here last year using Connected Nations engineers, drove 65,000 miles to pick up the state's infrastructure. And at the time, the FCC, when they estimated the funding at $1.6 billion, that was based on the fact that we only had 400,000 unserved or underserved folks in the state. And we did a challenge. We challenged, and we decided, or we found at least another 101,000 unserved or underserved areas. And so we turned that challenge in. And it was reported the other day that 52,000, we won the challenge for our, and it's still an ongoing process. We already picked up 52,000 unserved areas in the challenge, which would add, so now that's why they're saying it's now estimated that we're going to get about 1.9 billion, 1.8 billion. And that's going to help. And that'll be determined this summer. Well, they said by July 31st, but nobody's holding their breath on that one yet. And so that's kind of what we're done. We're also, we did a telemedicine study. We're working with the tribe, the Sioux tribe, which covers part of goes as far west as Manistee in Elgin County and also Marquette County. And we just finished up the survey for that telehealth study. And we ended up with about a 16% take rate. We ended up with about almost 1,100 surveys. It's got to be processed. And then they'll be up visiting the healthcare centers in those areas as a second phase of that. And it'll be similar to what the Central UP, I think that one's going to be a phone survey. I believe that's right, Ryan, a phone survey. And then, so that'll be happening. So that's kind of the quick update. And I think I sent Ryan the other day, the USDA sent out a new funding map. Did you get that, Ryan?
Yes, I did.
Okay,
Yep.
so I haven't had a chance to look at it really good and look at the legend. So there's a map, and you can share that in case people haven't got that. So
yeah, sure. I can actually share it up on the screen right now. This is the one you're talking about?
yes. Again, I got in late last night, so I haven't had a chance to play with it too much.
It's fundingmap.fcc.gov. If anybody wants to check that out, I'll send around the one sheet that Tom was just mentioning. And if that's it, Tom, does anyone have any questions for Tom? And if not,
I do have one more thing to add about the telehealth. When we were down in Traverse City, we went and met with the Munson folks, and they cover 23 counties, and they got a really, really good telemedicine program, one of the better ones in the country. And they had over 50 monitoring devices. And the idea of the monitoring devices is now catching on, putting monitors in the home, and those can be hooked up to weight scale, temperature, pulse, things like that, glucose level, oxygen level. And right now, they have all 50 out at all times, and they said they could use another 150. And so typically what they're doing now, when you come out of surgery, the surgeons are finding out it's quite helpful to have one in the home for the first 2 weeks. It eliminates about 85% of the readmissions. Unfortunately, they don't have, they're short at 150. They could use 200, probably 250. But the current monitors are roughly $5,000 a piece with all the equipment. So I just thought that's something that they're looking at funding. I think Stabenow's office got them $750,000 to buy more devices just recently from Congress. So, but that's something that's the doctors or the patients, the doctors and the nurses are catching on to, and they like these. And so now the demand for that's been going up ever since COVID. So.
Thank you, Tom. All right, well, it's time for partner updates. And Bruce, I know you had some updates that you wanted to share from Highline, so I'll let you go first.
Yeah, great to see everybody. Tom, great to see you over in Watersmeet this week. That was fun. Watersmeet is a good example, Ryan, where we had the opportunity to meet with the community and participate, but we're building over 1,000 homes this summer, starting in a week, to help the folks out in the Watersmeet area who are very desperate for better internet connectivity. And so that was it's just part of our 12 new cabinets that we're building in the Upper Peninsula this summer, passing another 10,000 homes. We're going to extend our network into Menominee County, Dickinson, Gogebic, Iron, Schoolcraft, Mackinac, and Chippewa. So we're extending our network. So we're very excited to bring fiber internet connectivity. Again, as everybody knows, our service, our baseline service is a gig up and a gig down. And we actually fulfilled all winter long, got some more winter drops to install, but we're hooking up hundreds of customers a month right now, and very, very excited to be able to help folks out who have been obviously desperate for better internet connectivity. So Highline continues to be one of the many companies in the Upper Peninsula that are delivering fiber to the home, and couldn't be more excited about the future of what happens with the Robin grant money. And then we have obviously put in a very aggressive application for that, and kind of everybody else kind of wait and see and kind of seeing what BEAD shakes out. But we call it grant stacking now to continue just to extend our network further and further out to get everybody the type of internet connection they deserve in today's day and age. So I'm really excited to be helping the folks out in the Upper Peninsula and downstate in the Thumb area, and just continuing to put our construction plan in process. We had our kickoff meeting last night at the Terrace Bay Hotel in Gladstone. We had a couple hundred people there who are all involved in our project, and everybody's excited and ready to get going. So we're moving forward. So thanks for the opportunity.
Oh, good. I'm happy to hear it. So I guess I want to ask a question to our ISP partners. Just wondering, what is the state of developing public-private partnerships with our communities here in the Central Upper Peninsula? And do you need any additional support from the regions in making those connections, or just looking for, I know that's a component of the Robin and of BEAD. And so I'm interested if there's any way that we can help.
Well, I would jump in. I mean, certainly for our Robin grant application, the support that we received, which was important, was a little, overwhelming and appreciated in terms of the ask and the response. At this point, I was speaking for Highline. I mean, we're not looking for individual funding from local entities, but we certainly are the support and the acknowledgement that the lack of internet connectivity exists, and any opportunity to help improve that, through letters of support or just making it known are super helpful for us as we continue to look to bring the money in to extend our network to help people out. So letters of support are terrific. And then, of course, I always say selfishly, the best way you can support Highline is by signing up. And so we are, the response that we're receiving is just, it's been terrific. And, it really shows that people are looking for better internet connectivity.
Thanks. Does anybody else have any other thoughts? All right, would anyone else like to provide an update? Jim, I know Merritt had a really big event, and I'm sorry that I missed that. But I'm interested to know how that went, and if you'd be willing to share.
Yeah, I had to get my microphone going. Yeah, it was a great event. We had over 400 people there from across the state of Michigan. Some really good environments or presentations and stuff. Got back in time last night for Highline's kickoff. And we got some projects going on too. Right now, we're in the middle of our Moonlight project. We just started moving our equipment out to basically do a forklift upgrade of all of our backbone optics. So that's in process, and it'll be going on in stages between now and probably first part of October. So that's about all I have at this point.
Thank you for that. Glad to hear it. Does anyone else have an update? Well, if not, and we were kind of competing against a very big meeting here, the UP Economic Developers Association. So we had a little bit of a lower turnout today, but I guess we can end the meeting early, and then anybody can hop on over to that one if they were planning on going to it. So are there any last thoughts before I close out? Nope. All right. Well, hey, thank you so much for attending this, and I'll see you next time. Bye.
Thanks, Brian.